Welcome everyone to our weekly Q&A session with Toronto's Associate Medical Officer of Health, Dr. Vinita Dubey. Thank you so much for joining us again today.
Hi, good afternoon.
Good afternoon. My name is Dilshad Burman. I am a writer and reporter with City and 680 News, and I will be moderating this chat today. The way it works is we've been collecting your questions all week for the doctor. She's never seen them before. We're going to present them to her today. If you haven't had a chance to submit your questions, you can still do so under this live broadcast in the comments, and we will try to get to as many questions as we can in the short 30-minute period that we have with the doctor today. We're going to get started with our submitted questions, but feel free to jump in anytime and let us know if you have a question. Doctor, are you ready to go?
Yeah, let's go.
All right, so once again, we're going to start with some vaccine questions because vaccines are top of mind for quite a while for people. So let's get started with our vaccine questions here. Let's start with Buddy and Jin. They both have very similar questions. So I'm going to read out Jin's question. They say, I'm an organ transplant recipient. My second vaccine is scheduled for 4 months after my first one. However, I just saw that it has been recommended that those with organ transplants should be getting their second dose 3 to 4 weeks after their first shot. How can I get my second shot changed to an earlier date as per these new guidelines?
Yeah, so good question. I think as you can see with all things COVID, some of the logistics sometimes can take a few more days to catch up to some of the decisions. So I know that there are, I think the best thing for you to do is to follow up at the clinic where you had your vaccine done. To see how they can override the system to change the vaccine appointment. It is a very small group of people who will get that second dose within a month. The research is showing that people who have had an organ transplant, once you've had one, you're on these very complicated drugs so that you don't reject the organ, which weaken your immune system. And that's one of the reasons why that's one of the groups that has that change. So I would follow up with the clinic where you had your first dose taken to see how they are managing that.
Okay. And then Jack asks, again, we have these 4-month delay questions. Jack asks, the CDC recommends waiting no more than 42 days after your first dose of the vaccine to receive your second dose. I understand the collective benefit of giving everybody their first dose sooner, but are there going to be medical or efficacy ramifications to delaying that second dose?
Yeah, so good question. So I think the one thing to note is in the US, they seem to have much more abundant supply of vaccine and we don't. And that's why this decision has been made. So I just want to put the context that it's based on supply of vaccine. And what we know is actually the CDC actually also last week put out a study that showed that the first dose provides 80% protection and the second dose 90% protection. So we know that that first dose provides good protection. We know that it lasts for a while, and even if the immunity wanes, it will wane slowly. And so, from a medical perspective, from a vaccine efficacy perspective, when you get your second dose at 4 months, it will still be a good booster response. We also know, like with the AstraZeneca vaccine, by delaying to 12 weeks, you actually get a better immune response than you do if you give the second dose sooner.
Right. Okay, so we've got some live questions coming in, actually. Let's go to those. Tony asks, will Canada have another vaccine choice other than AstraZeneca? And if so, when?
Well, right now, Canada has the AstraZeneca, the Pfizer, and the Moderna. Those 3 vaccines are currently available. Janssen is not currently available. And really, all we can say is on a week-by-week basis. There are other vaccines that are that should be coming to Canada to be licensed, but are not currently licensed. So there may be more than these 4 vaccines that may be available or licensed in the future as well.
Okay, and then Annie asks, because we just talked about priority groups who are getting their vaccine within a month or so. So Annie asks, I have COPD. Am I in that priority group? And do I tell them when I get my first dose of the vaccine?
Okay, so the priority group who are getting the second dose within a month are a very, very small group. So it's actively getting treatment for cancer or having an organ, having had an organ transplant, and that's it. And so it's a very, very small group of people who are getting that second dose 1 month later. It also includes, residents of long-term care homes, but they've already been vaccinated for the most part. For the otherwise, people with a chronic health condition, they will get their second dose at that 4 month interval.
Okay. And then Bradley asks, I guess this is a long-term question, but he says, what is going to happen to people that refuse to take the vaccine?
Well, I think right now we have to actually all do our part to actually get people who have questions about vaccines to have their questions answered, to have them answered with true answers, not with misinformation. And I think if we all get vaccinated and we share our stories for why it's important, I think part of the story has to be not just about the risks of the vaccines, but also the risks of COVID. And we've been living with COVID for too long, for most of us will say. And not only is it a disease, but it's impacted the way we interact with others. We felt overwhelmed. I mean, we've also identified heroes and had some other experiences of COVID, but to help get us out of this current situation, the vaccine is going to be our best bet.
Right. And then Aminul asks, can you explain how age and underlying medical conditions determine vaccine doses in terms of their brand?
So the AstraZeneca vaccine is given at 55 years of age and older, and it's 2 doses. The Janssen vaccine is licensed for 18 and up, and it's 1 dose, but we don't currently have any doses available here. The Pfizer vaccine is licensed for 16 and up, but right now, pediatrics are not identified in the prioritization plan, and it's 2 doses. And the Moderna is licensed for 18 and up, and it's 2 doses.
Okay. Let's see. Okay, we've got some more live questions coming in here. Maria asks, for someone who suffers from heart failure, which COVID shot should I take?
Take the first vaccine that's given to you. If you have a heart failure and you're 55 years of age and older and are eligible for AstraZeneca at a pharmacy, and that's what you're available to get, please get it, because all of the vaccines have been shown to reduce that hospitalization and that death, that severe infection. And someone with heart failure really needs to stay out of the hospital.
Yeah, absolutely. Actually, speaking of hospitals, then let's take this question from Maria, another Maria actually. Maria Antello asks, I am in hospital for an unrelated COVID issue, like unrelated to COVID. How likely am I to get COVID at the hospital?
So, I mean, COVID is spreading in the community. There is community transmission. We know when there's community transmission, it can put a burden on even those places that have layers of protection. So even in schools, even in hospitals, even in places where there's full PPE, there's always that risk. Now, in a hospital setting, they have a lot of controls in place to prevent the spread of COVID between patients, from getting it from a staff member. They have visitor policies in place. So your chances of getting COVID in the hospital are lower for sure.
Okay. And then Jill says, I'm asking for certainty. How do you know for certain that it's okay to wait for 3 to 4 months after the first dose to get the second dose?
Well, you know what? These decisions are made based on vaccine supply. And I think the one thing that we need to know is that there's a lot of decisions that are being made based on the current situation. And if we were giving the doses 1 month apart, many people that are eligible for vaccine right now would not be eligible. They would still be waiting for their turn, because all of those 80-year-olds and 7-year-olds who have gotten their first dose will now be up for their second dose. And so I think we need to think of it in the context of rising wave, of third wave, rising COVID infections. We need to get as many people vaccinated with that first dose to be able to help prevent that spread of that third wave. And we don't have enough vaccines to be able to give the second dose sooner and to be able to vaccinate as many people. And so the decision is based on the current context, but also with the current evidence. And the National Advisory Committee on Immunization just today released their updated statement that has some more of the evidence on why delaying or extending that second dose is based on evidence.
Okay, wonderful. And then, okay, we have lots more live questions coming in here. Okay, let's take Aurora. Aurora asks, how can I get vaccinated being a full-time caregiver for a senior? I'm not a PSW and not in the age range, but the family doctor said that I am eligible, but when I called, I was refused.
Right, so the eligibility, if you are a full-time caregiver, a primary caregiver for someone who has one of those health conditions that's considered highest risk or high risk. So someone who is physically challenged and is eligible for vaccine, they're allowed to have one essential caregiver. The essential caregiver has to be able to provide their activities of daily living for the better part of the day. And so even if someone is a transplant patient and has someone who provides that very intense care, they are eligible. So there are a few select groups of essential caregivers who are eligible based on the person's primary health condition.
Right, but they're saying that when they call, they're being refused a vaccine.
Right, so it's not every essential caregiver that is eligible right now, and so we're going to have to wait for again, it's because we don't have enough vaccine to go around. So what I would say is, right now, if you're an essential caregiver and you're not eligible, continue to keep your precautions in place so that the person that you're providing care for does not catch COVID.
Okay, and then let's take this last live question coming in here. Gurminder asks, when are restaurant staff getting vaccinated? What group are they in?
So essential workers are defined in the phase 2 prioritization and are defined for June. And there's a long list of them who are eligible. And the broad definition is unable to work from home. And so they would be eligible in June based on the current prioritization framework.
Okay. And then let's see, Priscilla asks, are you going to allow vaccines to remain 100% free choice, including not developing or enforcing vaccine passports so people can continue to keep their rights and freedoms in the country?
So right now, vaccination is a choice, and we're asking people to make the choice to protect themselves, to protect their community, and to get us out of the third wave. And it's not always public health that will require vaccinations in certain areas. I think you have to recognize that employers can develop their own policies to require vaccinations there. In schools, it can be provincial policy that requires vaccinations or exemptions in schools. And so I think you won't see any of those policies, though, until everyone who is eligible, who has a choice to get vaccinated, is vaccinated. I think those who have questions about vaccines, please do talk to your primary care provider, your physician, to have your questions answered so that you can make an informed choice for yourself.
Right, absolutely. And I think the question about vaccine passports too, private businesses also can pretty much do whatever they want. They have the right to refuse entry. They have the right to refuse service. So when it comes to private businesses, that's not really something government has a lot of control over as far as the rules that they implement within their own businesses, right?
That's right. So I can't comment on behalf of private businesses exactly. And so I think what we're going to have to see is, what is this going to look like? I mean, we've talked before as well about travel and how countries can impose it to travelers coming into their countries, that they're required to be vaccinated. And so some of the choices that people make will be based on, where they're planning to go.
Right. Absolutely. And then let's take another live question coming in here from Joanne. Joanne says, I've had blood clot issues in the past and for my age, but all they're offering here in my city is AstraZeneca. So what are her options?
Right. So Thrombosis Canada, which is a really great website if you have ever had a clot or have questions about clots, have really good information at the patient level as well too. And they have come out saying that the blood clots that are associated with the AstraZeneca vaccine are still on the rare side, between 1 in 100,000 to 1 in a million. And right now, I can tell you in Toronto, the rate of COVID in the community is 200 per 100,000. So it's 200 times more common than the rare side effects of this vaccine. But Thrombosis Canada also says that if you've had a previous clot, a blood clot, you have a family history of a clot, you yourself have had a clot, it is still recommended that you get COVID, because COVID is still a higher risk, and based on your age, if you're 55 years of age and older, can get very sick from COVID, including getting clots from COVID. And so that is currently the recommendation. I would say to you, if for your particular situation, please do talk to your doctor so that you can have that risk assessment done and talk about it particular to your situation.
Right. Okay, we'll go back to some of our submitted questions now over the week. Jamie asks, I am told by Ontario Health that my 32-year-old Down syndrome daughter is qualified to receive the COVID vaccine. So when I go to register on the portal, I'm told through an automatic reply that she doesn't qualify at this time. As parents of a Down syndrome child, we're aware through social media that others are getting vaccinated. Is there a separate website, or is there a separate system where people with special needs can get the vaccine?
Right. So the eligibility for the vaccines is not, it's being rolled out in different, slightly different timelines across the province based on vaccine availability and that kind of thing. So what I would say is, sometimes following up with the hospital that has that's vaccinating in your community is the best way to go. If you find on the provincial system you're not able to vaccinate based on the eligibility for the provincial system, see what the eligibility is like in the hospital area. We are all following the provincial prioritization framework. It just may be off by some time here or there, but for sure, in your community, the time will come if it isn't right now. But if you're looking for more clarification, follow up with your health unit or with the hospital that's providing vaccines in your community.
Right, because a lot of the hospitals actually have their own portals, which are different from the provincial. Like you said, they're still following guidelines, but the portal itself is different and may not have those same restrictions as the provincial one.
That's right. So the booking system is different, and the eligibility is sometimes they are vaccinating those who have chronic health conditions, for example, and that is the eligibility that they're using at their clinic. So, and that's why it's important to follow up there specifically.
Perfect. And then one more live question coming in here. Soha asks, what kind of vaccine is best for epilepsy, for people who have epilepsy?
Any vaccine, actually, as long as you are not, do not have a severe allergy to any of the components, which again is very, very rare, you should get the first vaccine that's available to you based on your age.
Okay, wonderful. Okay, let's go back to, once again, these submitted questions here. Jason has an interesting one about mRNA vaccines. He asks, could the first mRNA dose, which tells the body to create the spike protein, cause existing COVID-19 infected cells to mutate in the recipient's body? Is that the reason why variants and infections are increasing after an increase in mass vaccination?
So variants were actually already spreading. Viruses were mutating even before we had a vaccine. So the mutations are not dependent on the vaccine. It's not the vaccines that have caused the mutations. This is what viruses do. We know that. And so we can actually expect that the viruses will continue to mutate even after we have vaccines, but it's not because of the vaccine. So I think that that's an important point to note. And so, no, it's not because someone who had COVID got vaccinated. That's not the reason why we're seeing these variants spread.
Okay. And then somebody who calls themselves Moving asks, I have to move internationally in 2 months for work and will need to provide that I have had my COVID vaccinations before being able to enter the country. At that time, I won't qualify yet for Ontario's rollout plan. How can I navigate this situation and get my vaccination?
So there is no, like the prioritization is the prioritization, and the hope is that by June, everyone who wants a vaccine will be eligible for a vaccine. And that's all I can tell you right now. I think if you're moving and that's a condition of employment or entry, you'll have to follow up with your employer to find out then whether that you can get vaccinated when you get into that country. But there is no way for these situations to get vaccinated sooner.
Right. Because it's like you said, it's not a priority group in terms of illness or age or anything like that. And then, doctor, when it comes to, you know, getting your vaccine, like you said, it's within the provincial system, but will things possibly change if supply issues are sort of mitigated and relieved a little bit?
Oh, yes. So if we have more supply, then we can move through that prioritization framework quite quickly. Exactly. So, you know, it talks about the dates like June for essential workers. If we have enough vaccine and have gotten through some of the other groups sooner, that will be sooner. We won't be sticking to the timeline. The timeline is a guide based on what we're expecting in terms of supply. But if we get more supply, absolutely, we will vaccinate people sooner.
Okay, wonderful. And then let's go to another live question here. Bruce asks, can you tell us more about the strategy to handle the South African variant of COVID-19? I've read that our current vaccines don't work against that variant and it's spreading here now.
So the main strategy against variants is actually our public health measures. And so we know that even with the South African variant, if we continue with our distancing, our masking, washing hands, staying home when we're sick, that will help to prevent the spread of that variant and the other variants. There is some data available that, for example, the Johnson & Johnson vaccine has protection against the South African variant. So while that is licensed, it's not available here. And then there's more data coming out on Pfizer and Moderna related to that variant as well, too. The predominant variant that we are seeing, though, in Ontario, in Toronto, is the UK variant. And we do know that the vaccine will provide protection against that variant.
Okay. And then another live question coming in here from Gail Dobson. Gail asks, are joint replacements considered a transplant? And so then would you be in that priority group for transplants?
No, a joint replacement is not considered a transplant. A transplant refers to getting an organ from someone. Transplant patients are then followed by transplant teams where they're on actually high dose, usually high dose immunosuppressive drugs, and that's so that they don't reject the organ. And that's what puts them at higher risk for not mounting an immune response to the vaccine.
Right, absolutely. And then Tina has an interesting question. Tina says, I am allergic to the MRI contrast that has tromethamine in its ingredients. It's also listed in some of the vaccines. So how do I prepare for this if I have to take the first vaccine that's offered to me?
Okay, so so what I would suggest you do is you follow up with your allergist, because allergists are actually able to give you a better decision based on what your allergic reactions were. Can you have the vaccine but have it in a supervised way? Can you start by giving a very small bit of vaccine, see if you have a reaction? If you're okay, then continue to receive the rest of the dose. So I would first thing follow up with your allergist on that. And then when you are eligible for vaccine, if your allergist says absolutely you cannot get the Moderna vaccine, then you're going to have to find out what vaccine is available at the clinic. But your allergist may be able to help you navigate that as well.
Okay. Right. So that's it for live questions right now, but you can keep submitting. We'll keep asking the doctor. We have about 8 minutes to go. So I'm going to go back to our submitted questions here. Nancy asks, what is the formulary difference between Johnson & Johnson and AstraZeneca since they are similar? What is the likelihood that the same issues surrounding AstraZeneca might be encountered with Johnson & Johnson?
Yeah, so that's a good question. Both of these vaccines are what we call viral vector vaccines. And so they both use an inactivated cold virus, it's called an adenovirus, in order to attach the instructions so that you can eventually make antibodies. And so is it a class effect? Is it, because they're viral vector vaccines, what's happening with AstraZeneca may also be occurring with the Johnson & Johnson? That's something that's being actively looked at. There haven't been as many doses of the Johnson & Johnson vaccine given worldwide. Unlike AstraZeneca has been used in Europe, and millions of doses have been given there. So this is something that is certainly being followed to be able to investigate that.
Okay. More live questions coming in now. So Gail actually has the follow-up question after her joint replacement question. She says, I have lupus and take prednisone and chloroquine and Imuran. Should I get the second dose sooner than later?
So right now, people who are immunocompromised because of drugs, and that's what you're describing, or have an autoimmune condition, are getting the second dose at that 4-month interval. And so I think the way to understand it is, in order to protect you, even though you are at higher risk, you got your first dose, I hope, and are keeping up with your public health measures. And now vaccinating as many people to get the rates down in general is still going to help you and benefit you, and may have, the modeling suggests, may have a better impact on benefiting you than actually giving you your second dose sooner. Okay.
And then more live questions here. Rose asks, my 16-year-old daughter has an anaphylactic allergy to nuts. Is it safe for her to take the vaccine?
So an anaphylactic allergy to nuts is not a contraindication to any of the vaccines. And so if that is your only allergy, then the vaccine is safe for you.
Okay. And then another question about reactions to vaccines. Dave says, I have MS and I'm not allowed the flu shot. Can I take these COVID-19 shots?
Yes, so having MS or having a neurological condition is not considered a contraindication for the vaccine. And in fact, having MS actually means that you're eligible to get vaccinated now, because that's one of the neurological conditions that's identified as being at higher risk. And so you can actually go out and book your appointment.
Right, okay, wonderful. And then Callista asks, Callista says, as an essential worker at LCBO with asthma, I was told by someone on the official site number when she called that I would only be considered in phase 3 due to my age being 22. Why is this the case, considering that I'm higher risk because essential worker plus asthma?
Right, so the essential worker list, I think we're going to have to see how it rolls out and when vaccine is eligible. Excuse me, if you're identified as an essential worker, it's not age-based, but they may roll it out by age. So I think you'll just have to wait and more to come on that.
Right, and I think it's in the priority group 2 of phase 2 where retail and other front-facing workers are situated in the timeline, I think.
That's right. And right now it's the second part of phase 2, right now slotted for June. But again, if we have more vaccine, it may come sooner. And I think it's important to note, after that will be vaccine eligibility for everyone else as well.
Right. And then Dave just has a follow-up question regarding the MS. He said, can I get the vaccine shot? So he says, what vaccine are you talking about? Is any vaccine okay for people with MS?
Any vaccine is okay. MS is not a reason to self-select different vaccines. So, yeah.
Okay. And then another question from Rose here. If someone has been infected with the original COVID virus and is assumed to have some immunity afterwards, are they also immune to the COVID variants during that immunity period?
So we're not sure on that. There may be some immunity, there may not be. And the thing is, we know, though, that from that natural infection, the immunity won't last, not for most people, because we've seen people get reinfected. And so that's why as soon as you are no longer contagious, if you're eligible to get vaccinated, even if you had COVID, please do sign up to get vaccinated.
Okay, and we'll just jump back into the submitted questions that we have. Jay asks, after getting the Pfizer vaccine, can I use a nasal spray that contains hormones?
there's no contraindication to what medications, like if you're using certain medications after you get vaccinated. In fact, even sometimes people are worried about the side effects that they have for a vaccine, that they have muscle aches or they have a headache or they have a fever. You can still take those over-the-counter medications that you might have taken, like acetaminophen or ibuprofen. If that's something that you would have taken if you had, muscle aches or a headache or fever, you can still take those even after getting vaccinated. It's not going to interfere with your immune response.
Okay, good to know. And then Anonymous asks, we've talked about this a little bit earlier, but let's talk about this. Why do they not allow anyone to fill the empty spots for vaccinations that are being reported? If we do not want to waste the vaccines, and it's being reported that, for example, in Ottawa, 5,000 doses were unused because of no-shows, instead of insisting on like an age or a specific condition, why don't we just open it up to anybody?
So the vaccines are not wasted. It's just that the wasted means, for me, means that they were thrown in the garbage, and they're not wasted. But so what we need to do, though, is to get people who are eligible. The reason why there's a prioritization is because the people who are up next are at higher risk. They're at higher risk for getting very sick from COVID or from dying from COVID. And so we need to make sure that those people who are eligible book their appointments and come to their appointments. As there's more and more spots available, then you'll see the next group will be eligible to book appointments. But we do need people to book appointments and come at their appointment time. Walk-ins are not a good option, because when we have too much crowding, then we can spread COVID, and we don't want to see that at our clinics.
Right, absolutely. Sorry, I just want to quickly apologize to the two Daves that asked the question. Dave Rodman asked the question about MS, and Dave Reyes asked the question about what vaccine the doctor was talking about. My apologies to the two Daves. I got those mixed up. They were both Dave and R, and I got those mixed up. Sorry about that, guys. And actually, that brings us to 1 o'clock. That half hour went by so fast. Thank you so much, Doctor, for all your insight and answering all these questions. Thank you to everybody that submitted live. This was really great. We do try to get to as many live questions as possible. So thank you again for your participation. And we will have the doctor back next week. So keep those questions coming. Thank you, Doctor.
Okay, bye-bye.
Bye.